So the aim of PPE, that is personal protective equipment, is to determine the equipments to use for a given procedure. The healthcare workers should consider the following factors. So they should know the factors where to use and which personal protective equipment to be used. So what is the probability of exposure to blood and body fluids, or type of body substance involved, and probable route of transmission of infectious agent. So transmission of infectious agent by inhalation or by direct contact or by indirect contact. So this is important. So for direct contact we will use mainly gloves, and for inhalation purpose the main PPE is, that is mask. So depending on the exposure, type of body surface involved, and transmission of the route of the infectious agent, so these are the factors. So full protective wear including double gloves, protective eye, face shield, protective footwear, gown and apron is recommended for operating room or mortuary procedures. So PPE are used to protect skin and mucous membrane of healthcare worker from exposure to blood and body fluids, and from HCV to patient, that is from healthcare worker to patient during the procedures. So it is to and fro procedure. So transmission of infection from patient to healthcare worker, from healthcare worker to patient. So to prevent this, we have to use personal protective equipment, so for the safety of the patient and for the safety of the healthcare worker. So the contents are gloves. So when you're touching blood or equipments, invasive procedures, you have to use gloves, gown or plastic apron while surgery, surgical mask or N95 mask while surgery, droplet or airborne infection, cap, face shield, goggles when the major is spillage of blood or body fluids expected, and surgical shoes in ICU or operation theatre. So first is gloves. So use of disposable gloves is part of the standard precaution. The uses are as part of personal protective equipment. Gloves prevent contact with blood and body fluids and mucous membranes. They also protect patient from contamination by microorganisms from the healthcare workers' hands. So gloves are single-use items and changed after each procedure to further minimize the risk of infection. So separate pair of gloves is used for the separate procedure or for the separate patient, and for the same procedure patient, if the gloves are spoiled, then you have to, for the same patient also, you have to change the pair of gloves. So gloves are worn when dealing with blood or body fluids such as synovial fluid, peritoneal fluid, amniotic fluid, pleural fluid, any wound or broken skin, handling chemicals or disinfectants. So while handling chemicals and disinfectants, we can use domestic or industrial gloves. Second is gowns or apron. So purpose of wearing gown and apron is to protect susceptible patients from infection and protect the healthcare worker from contamination. So, and it is a uniform or clothes they are used in a clean and dry state. So gown and apron should not be worn outside the area they are intended to be used. Remove gown and apron when moving out of area. Then face protection. So protective eye or face wear are considered where risk of blood and body fluids splashing into the eyes, the possibility. So or while preparation of cytotoxic or chemotherapy drugs, and then during the physical decontamination or cleaning of the instruments. Then mask. So mask offer protection against potential splashing of the mouth and face during certain procedures such as minor operation, physical decontamination or cleaning instruments with a brush. So there are two types, surgical mask and N95 mask. So surgical mask mainly used for during surgical or dental procedures, and N95 mask mainly used attending the patients with acute pulmonary tuberculosis or nowadays the pandemic of COVID-19. So now what are the precautions? So they should be fitted and worn according to the instructions, not touched by hand while being worn. Then cover both mouth and nose, should be removed as soon as possible if they become moist or spoiled, and removed by touching the straps, not by touching the mask. And then hand hygiene should be there after removing the mask. shoe cover before entering the ICU, operating theatre, dialysis or CSSD room. Then protective footwear. Again, footwear is also important to protect legs from the sharp injury. Then head cap covers the hair of the healthcare provider in order to prevent the contamination of sterile high risk areas. So PPE are used to protect skin and mucous membrane of healthcare worker from exposure to blood and body fluids, and from HCV to patient, that is from healthcare worker to patient. So now how to wear that, it is called as donning of the PPE. So wearing of PPE is called donning, and removing of the PPE is called doffing. So the main sequence for donning is first to wear gown, then mask, then goggle or face shield, and then in the last gloves. Doffing, so while removing, first you have to remove the gloves because they are soiled. So first you have to remove the gloves, then goggle or face shield, then gown, and then in the last mask. So in this picture you can see the steps of donning and doffing. So donning for the gown or for the using, so first you have to insert your hands inside the hands of the gown, and then wear, and then pull the gown over your head, and then tie the back at the waist. While doffing, you have to pull the gown forward with both hands, breaking away from the back, neck and waist, then pulled away from the body, and then roll into a ball, and then you to dispose of in a disposal bin. The rational use of gloves. So how to wear gloves? So first you have to use your dominant hand, then with help of, first hand hygiene is important, after that dry your hands, and then put your one dominant hand inside the one glove, then with help of second glove you can use with the gloved hand, and then use the another hand, then insert, and then wear it properly. So while removing, pinch or hold the outside of the glove near the wrist area, then away from the wrist, turning the glove inside out, then roll it in a gloved hand. Then in fourth step you have to put your ungloved hand inside the gloved hand with help of fingers. Do not touch the outer surface of the glove because now your next other hand is ungloved. Then peel downwards away from the wrist, turning the glove inside out, and then continue to pull the glove down and over the inside out glove being held in your gloved hand. So the one first glove you have to put inside the another glove, and then put it in a bin, and then hand hygiene. Now how to wear mask. So in mask, in this picture you can see these total 6 steps. So how to wear a mask? So first you have to do hand hygiene, then wear mask by holding straps, then pinch to ensure no gaps are left, and then secure properly underneath your chin, and then over the nose tightly. How to remove mask? Wash hands thoroughly, remove mask by holding the strap, then discard single use mask, wash your hands again. These are my references from which we can study. I hope this session you will find useful. Thank you.